Dr. Baker in class. My audience today is Paul, Tony, Daryl, and Mary, who's recording. I'm here today to tell you about an illness known as generalized anxiety disorder. Generalized anxiety disorder is one of the most common mental illnesses. It affects about 6.8 million adults in the United States. It's a psychological disorder characterized by excessive or disproportionate anxiety about several aspects of life, such as work, social relationships, or financial matters. It's pretty much excessive worrying almost every day about things that may or may not happen or matter. There may be times that the individual's anxiety doesn't completely take over their life, but the anxiousness is still there. The anxiety someone suffers with can cause significant problems for the person or those close to them. Throughout this speech, I will discuss the symptoms, who is at risk, the treatment options, and who treats the disorder. First off, there are both behavioral and physical signs and symptoms. I will start off by discussing the behavioral symptoms, which consist of persistent worrying or obsessing about small or large concerns that are out of proportion to the impact of the event, inability to set aside or let go of a worry, inability to relax, restlessness and feeling on edge, difficulty concentrating or feeling like your mind goes blank, worrying about worrying, the stress about making decisions for fear of making the wrong decision, carrying every option in a situation all the way out to its possible negative conclusion, and difficulty handling uncertainty or indecisiveness. As I mentioned, there are also physical signs and symptoms of the disorder, which include fatigue, irritability, muscle tension or aches, trembling, being easily startled, problems sleeping, sweating, nausea, and headaches. All of the symptoms I mentioned can vary from person to person. Generalized anxiety disorder can affect children, adolescents, and adults. Although it's known that women are more at risk, it typically starts when you are a child or a teenager. The anxious feelings are somewhat the same from childhood to adulthood, but the anxiety will change as you age. For a child with the disorder, they may not be able to pinpoint what is causing their anxiety or why they feel this way, but some questions or fears they might sound a little like this. What if something bad happens to my mom or dad? What if my parents forget to pick me up after school? What if my house catches on fire and everything is ruined? What if I get sick or someone in my family gets sick? What if someone breaks into my house? What if I'm kidnapped and I never see my family again? And then once the years pass by and they are no longer a child but a teenager, the causes of anxiety will change. A lot of time their fears are about school, peers, the future, family, past behaviors, upcoming events, and their own personal abilities. Oftentimes, teenagers suffering with generalized anxiety disorder place the blame for their anxiety on things outside of their control, but really they are only triggers. They are actually causing their own anxiety. It seems as though this is similar to adults as well. Adults have similar fears, but they tend to be about work, financial matters, family, and the future. No age makes it easier to cope with the disorder. It's very difficult for someone to suffer with the disorder without seeking out treatment. Although there are treatment options available, unfortunately there is no cure for generalized anxiety disorder. The treatments help the first person to feel better and give them the ability to get through their day, but their illness will never go away. In order to get help, there are several people that will assist you in your treatment. They are your family doctor, a psychiatrist, and a therapist. It's up to you how you want to go about your treatment. The treatment options that are available are typically medications and therapy. There are several types of medications that are used to treat generalized anxiety disorder, the first being antidepressants. The antidepressants fall into two classes, SSRIs, which are serotonin reuptake inhibitors, and SNRIs, which are serotonin norepinephrine reuptake inhibitors. Some examples are Lexapro, Cymbalta, Effexor, and Paxil. The other form of medication is known as benzodiazepines. They are sedatives that may be prescribed by your doctor to relieve symptoms of anxiety. Some examples are Xanax, Librium, Valium, and Ativan. They are generally used to treat only on a short-term basis because you can become addicted to the drug. If you decide to take medication for your illness, a therapist cannot prescribe medication. Only your family doctor or psychiatrist can. Along with medications, patients go to therapy. There is psychotherapy, which is also called talk therapy, and cognitive behavioral therapy. Therapy is usually the option that is chosen for children. There are a lot of side effects that can occur with taking these medications, so it's too much of a risk for a young child unless it's absolutely necessary. Psychotherapy involves working with a therapist to reduce the symptoms of anxiety, and cognitive behavioral therapy is one of the most effective forms of psychotherapy for treating generalized anxiety disorder and other mental illnesses. It teaches specific skills to gradually return to activities you've avoided because of anxiety. Symptoms will begin to improve over time. This is usually a short-term treatment. I have personally suffered with severe anxiety for my whole life. It started when I was young and followed me throughout the years. I was guilty of always hiding it until it got to a point that it was way too hard to cope with. After doing more research on the disorder, I noticed that some of the questions I found that a child would be thinking that I mentioned were very similar to how I spent a lot of my time thinking when I was younger. Nowadays, a lot of the time, I don't know what's making me anxious, but the other times I do. My anxiety has been so bad at points that it has affected my daily routine. It's definitely difficult to deal with at times, but I have learned to cope with it more than I was able to in the past. I've come to realize that it's not something to be ashamed of. So many people suffer with anxiety, and no matter what the severity, it's okay to seek out help to learn how to deal with it. I hope that anyone who is going through this will also seek out help if you haven't, because it can really change your life. I know if I didn't, my anxiety would still be just as bad as it was. So I pulled this picture up because if you've never had a panic attack, this is literally what it feels like. You have so many thoughts running through your mind at the same time. And I know personally when I've had a panic attack, I could be in the car, in the middle of class. So it's scary when you're in a situation around a lot of other people that you don't know. I know that I begin to get shaky and lightheaded, and I feel like I could pass out at any moment. So it really is a scary feeling. But to finish up my speech, I would just like to say that generalized anxiety disorder is a form of mental illness. It's an illness many people suffer with on a daily basis. Many people tend to brush their symptoms off and never tell anyone how they feel. They believe people will judge them because of it, and sometimes people do. Mental health is so important, not only to those suffering, but for every person in general. Any form of mental illness should not be taken lightly. It's a very serious issue that must be addressed. You wouldn't look at a person suffering with diabetes or cancer and refuse them treatment, or judge them because of their illness. The same goes for any person suffering with a mental illness. It too is an illness that you have no control over. Don't be afraid of being looked at in a certain way. It's more common than you know, and many people are going through the same thing. If you or anyone you know is suffering with a mental illness or shows any signs and symptoms, speak up. Don't let it go. Get yourself help or encourage your loved one to seek out help as well. Get the proper help that you deserve. Thank you.